Hello YouTube, I'm Dr. Fox. Today, I'm talking about safety to take medicine while you are pregnant. Are you considering getting pregnant or already had the good news confirmed? If so, it is important to be aware of which medicines you can take and which to avoid. So ask your doctor about any medicines you regularly use, including any that are on prescription or obtained over the counter. Also, include any herbal or vitamin supplements you might be used to having in your diet. Second, the ideal approach to handling any ongoing health issues while pregnant. Last, any personal issues and ambitions related to your baby's health and your own. Okay, then what can we be clear on concerning medicine while pregnant? Almost every pregnant woman will face a decision about taking medicines before and during pregnancy. However, we know little about the effects of taking most medicines in pregnancy because pregnant women are often not included in studies that determine the safety of new medicines. Nevertheless, we can be sure of the following. First, it is common for women to need medicines for certain health conditions while they are carrying a child. It can also be a reality that stopping a certain medication can prove damaging by first affecting the mother's health, then consequently the baby. Second, however, we know that particular medicines can increase the risk of unwanted effects. For example, physical disabilities and in some cases even contributing to infant deaths, prematurity, and stillbirth. Additionally, many other factors impact on how medicines affect you and your unborn child, like the dosage you rely on, the pregnancy period in which the medicine is taken, related health issues, and other medicines it might interact with. Okay, so are pregnant women safe to use medicines? Seeking an absurd answer to this is without merit. The best approach is to consult a medical professional before taking on any medicine and read up on any complications that might affect you so you can respond quickly to them. Okay, next question. How you can reach a calm decision on the medication use? In concluding that a particular medicine is of benefit to you, make sure you discuss the benefits and potential risks of taking it. What benefits you or your baby as a result of taking medicine, and in what ways can the medicine potentially cause damage? Inevitably, challenges may occur when you are with child that require medication. With such a scenario, bear in mind that because you're pregnant, that might result in your doctor prescribing a different medication than they usually would. Plus, there may be examples of everyday illnesses that you would usually take medication for, such as colds or headaches, which you decide to just put up with because of the pregnancy. Nevertheless, there may be times when medication is necessary, whether for a short time or even over a longer period, like a few weeks. For example, strep throat or a bladder infection will require antibiotics. In addition, ongoing conditions may require medicines such as with those women who suffer from depression, diabetes, or asthma. Furthermore, the pregnancy might cause problems that do require medication to manage, especially those who have a special need of guarding against preterm labor or miscarriage, but also for severe forms of nausea or vomiting. Okay, next. Some of you might wonder that should you think about medicine while trying for a baby? Predicting a conception is very difficult, and then being sure that you're pregnant might not be possible for 2 or 3 weeks before attempting to conceive. Be sure to do your research and ask your doctor for advice on any medication you rely on. They may advise on changing some medications or stopping them completely, and this is likely to differ for each, so don't simply follow what proved right for a friend. Be worried about making decisions on your own, even if online research suggests you should. as such research can prove very general. Next question. If you took a medicine before you knew you are pregnant, what should you do? Okay, first of all, don't panic. Consult your doctor as soon as possible and they can advise you on how to proceed or on any checks. Some medicines have possibility of being harmful to pregnancy, but that does not mean they definitely will. Just like if you have been smoking or drinking alcohol. Move forward with a more informed approach by consulting a medical professional. Then next, how usual are herbal or homeopathic remedies and aromatherapy. These can look harmless, but the fact is that some complementary therapies and other remedies described as natural can be unsafe for babies. This might be because of the quality of the product itself, considering they come from many obscure sources. For example, some have been found to contain lead, which is harmful for an unborn baby. Only use them if consultation recommends doing so, and do not keep your pregnancy secret from anyone advising alternative medicines. More typical antenatal care should not be overlooked in favor of such therapies or remedies, so continue to attend these as your baby grows. Next question. Are over-the-counter medicines safe to take during pregnancy? Many of us depend on medicine that can be requested over the counter, but without a prescription, like pain relievers and cold medicine to treat common conditions like a headache or sniffy nose. However, be aware that not all of these are ideal for a pregnant woman, including some herbal products and the increasing range of supplements becoming available. If you rely on any of these and discover you are pregnant, consult your doctor as to whether it is okay to continue as normal. Note that many over-the-counter medicines will advise the same thing if you read their labels after purchase. One such example of a regular medicine, often even found on the stands rather than over-the-counter, which can cause problems during pregnancy, is that of ibuprofen. If taken during the last few months of pregnancy, this drug can cut off blood flow to your baby, so needs to be avoided. The majority of women about to become mothers can use acetaminophen as pain relievers, but even those drugs that are acceptable needs to be taken as described in the product label. This can cause liver damage to our pregnant women. As ever, consult your healthcare provider rather than assuming something might be safe. Okay, last question. Are supplements safe to take during pregnancy? The answer is it depends. People take supplements to make up for missing a certain nutrient their body requires. For example, people might take vitamin D to make up for a lack of sunlight. Other examples include magnesium, iron, calcium. As ever, all pregnant women should consult a medical professional, though they may also be prescribed about 600 micrograms of folic acid every day, so they are not to be completely avoided. Nevertheless, advice is essential and might differ for each mother depending on their own circumstances. Also bear in mind that it is possible to take more nutrients than your body needs, which could be harmful during pregnancy. In conclusion, the safest approach is to avoid relying on medicines while pregnant, unless you and your doctor determine that it is necessary. A select number of medicines are found to suit pregnant women, but effects on the baby are often ambiguous. In the event that you are already on prescription medicine and have become pregnant, certainly consult a healthcare professional on how you should move forward. When a medical complication occurs, your healthcare provider will seek a way to treat it without affecting the pregnancy rather than allowing it to linger. The right treatment for most conditions when a woman is pregnant is generally the same as the right treatment when she is not pregnant. Consult your doctor before stopping any medication. To source more details on medications you are considering, always consult a doctor or healthcare expert. Bear in mind that while scanning, the internet can be useful. Using it as a decision-making source is not reliable, as facts are not always vetted and stories may revolve around the most extreme cases.